All right, let's go ahead and just get started. We have a lot to cover in this presentation. So thank you everyone for attending. This session title is How Place Impacts Health Equity. We're really excited. We have some really great panelists to present today. My name is Stephanie Tomlin. I'm a UDOT Transportation Planner in the Central Planning Division. So I'll go ahead and I will be the moderator for this presentation. So I'll just bring up at the end the questions and I'll present on some resources. But I'm excited to turn the time over to our four great panelists today. So we have Ashley Cleveland. Ashley Cleveland is the Promise Program Manager for Millcreek. Ashley is an ex-ecologist turned city planner. She is very passionate about what space and place means for minoritized communities and how investing in equity could create better outcomes around health, safety, economic well-being, environment, and education. We also have Sarah Hodson. Sarah is the Executive Director of Get Healthy Utah. She's been in that position since 2015. Get Healthy Utah is a collaborative effort focusing on improving health in Utah by supporting healthy eating and active living. Get Healthy Utah uses a multi-sector approach to align efforts and partnerships throughout the state to see better results. We also have Molly O'Neill Robinson. She is the Planning Manager in Salt Lake City Planning Division. Molly has led Salt Lake City's urban design efforts for 8 years, developing design policy and representing the city's urban design interests in major development projects. Her work has given voice to people typically marginalized in the public process, such as immigrants, LGBTQ communities, through non-traditional methods of engagement. And then we also have Sharon Howery. Sharon is the South Salt Lake City Urban Design Director. Sharon has planned and designed public projects at all scales. She has a passion for both cities and wild places and found both all in Utah. As the Urban Design Director for South Salt Lake City for the last 9 years, she has helped the community envision its leap from an inner ring urban suburban to a walkable urban neighborhood. So with that, I'm going to turn the time over first to Sarah.
Thanks, Stephanie. I'm really excited to be part of this panel today and part of this conference. So just a little background about Get Healthy Utah. We're a nonprofit focused on physical activity and healthy eating. You can see our board of directors here. And the work we do, we understand that where people live matters to their health and has a significant impact on their health. And that's what we'll be talking about a little bit more today. So I wanted to just start by providing a few definitions to help us be on the same page for this conversation. So first is health. And I know for a lot of us right now, COVID is on our minds as when we think about health, but I'm hoping today we can have a broader conversation and think more holistically about health and well-being. So a kind of a complete state of physical, mental, and social well-being, and not just the absence of disease. Second is health disparities. So these are differences in health outcomes that are linked to social or economic disadvantage. The Utah Department of Health Office of Health Disparities has a simple way of talking about health disparities, and they say they are avoidable, unfair, and unjust. So when we look at health outcomes, and if we think about is that avoidable, unfair, and unjust, then we know that's a health disparity. And here are two examples you can see on the screen here. On the left is adults with diabetes in Utah and by income, and those with an income of less than $25,000 a year have much higher rates of diabetes than those with higher levels of income. And on the right, you can see breast cancer incidence rates by race. And in the middle, Pacific Islanders have a much higher rate of breast cancer than the state rate. So these are two examples of health disparities in our state. And then the next definition is health equity. And health equity is when all people have the opportunity to attain their full health potential and no one is disadvantaged from achieving this potential because of social position or other socially determined circumstances. These two graphics kind of show you visually what that might look like, and there's lots of examples you can see of graphics like this, but I think the key here is looking at that equality does not equal equity, and so an equitable approach would be looking at the differences and disparities within our communities and addressing those directly. In 2019, Get Healthy Utah and the Utah League of Cities and Towns worked together to hold a focus group for city leaders, and we had 25 leaders from throughout the state come together and talk about health, the health in their communities. So we just wanted to get their perspective on what they thought about community health. And there are lots of really interesting findings from that focus group, but I just was going to share one today that's related to our topic. And one of the questions we asked them was, do you agree or disagree that all community residents have equal access to opportunities to be healthy? And what the results showed was that while slightly over half disagreed with that statement, still nearly half of the participants felt like, yes, all community residents do have equal access to opportunities to be healthy. And unfortunately, we know that that's not the case. In reality, we know that where people live, work, and play has a significant impact on their health outcomes and their opportunities to be healthy. This is a map from the Kim Gardner Policy Institute, and it's a little bit blurry on the screen, I apologize, but it's life expectancy throughout Utah. And in the called out box on the right is the Wasatch Front, and you can see here that the life expectancy in Glendale is 74.4 years. And just right next door in the Avenues, life expectancy is 84.1 years. So that's a 10-year life expectancy difference in essentially two neighboring communities. So we know there's a lot of disparities and inequities that are happening right here. You probably have heard the term social determinants of health in a lot of different contexts. And the idea here is that there are many different things that play a role in our health outcomes. Some of these are from the built environment, some of them are for the natural environment, but oftentimes these are things that are related to discrimination and systemic problems within our communities. This is the graph on the left is from the Kaiser Family Foundation, and there's lots of different versions of these social determinants of health charts. But you can see here that a number of the things in these different categories are the role of cities and towns. So if it might be housing or transportation, parks and playgrounds, accessibility to healthy food options, so that might be related to grocery stores, that sort of thing. So there's a lot of places where city leaders can make an impact in these social determinants. Just wanted to provide kind of one specific example. This is, for Get Healthy Utah, we are focused on, like I mentioned, improving access to physical activity and healthy eating with the overall goal of reducing the level of obesity in the state. And so if we want to address obesity, we need to think about physical inactivity, which is one of the primary contributors to obesity. And when we want to address physical inactivity, then we need to think about residents' access to recreational facilities and opportunities to be physically active. And what we know that residents in low-income communities and communities of color have significantly less access to these opportunities. So this is just an example of how those social determinants play out in a specific health outcome that we are concerned about. These maps help provide a little bit of comparison between a particular social determinant and a health outcome. And this comes from City Health Dashboard. It's a great resource, particularly for mid to large sized cities. It doesn't have a lot of data for smaller towns and rural areas, but for mid to large cities, you can go to the City Health Dashboard, put in your city, and then there's a list of 10 or 20 different metrics that you can map out and look at. And in this case, we're looking at income inequality and life expectancy in West Valley City. And so while these are not duplicate maps, so you wouldn't be able to completely compare one to the next, they are very similar. So we see in incomes where there's high levels of income inequality, which are the darker areas, the life expectancy is lower. Here's another example in Salt Lake City. This is for child poverty and life expectancy. Again, the maps line up pretty consistently there. So I wanted to just quickly take kind of a step back and look at a different set of maps. This is looking at, on the left, a redlining map of Salt Lake City, and on the right, life expectancy in Salt Lake City. And the redlining map shows what was a practice called redlining, which many of you I'm sure have heard of, which is a systemic discrimination where mortgages and loans were denied because of race and ethnicity based on location. And the term came about because lenders would actually draw a red line around those communities. And you can see on the map here, the areas that are red are defined as hazardous, and then blue is best, and yellow is a declining area. So residents in these neighborhoods, which were largely inner city areas with minority populations, the lenders regarded the credit risk as too high, and so mortgage insurance was denied. And then this practice guaranteed that the families in these communities were blocked from purchasing homes, which blocked them from building wealth and then moving into new suburban areas that had high resourced communities. For those of you who attended the opening session just before this breakout, Reverend Davis gave some personal examples that I thought were pretty powerful of what this looked like in his life in terms of education, healthcare, housing, and the experience that he had in, from this type of discrimination. And so you can see that the map on the left, the red areas, are correlated to the map on the right, the darker blue areas. And again, if we didn't have health outcome maps, we could use redlining as a proxy to show us where the negative health outcomes occur in our community today. And the important part of this, I think, is to think about that these communities were intentionally created by these kinds of practices. And so we have a lot of work to intentionally fix the problems that still exist as a result. You can find redlining maps for Ogden as well online. Here's an example of the redlining map in Ogden. And then I wanted to just quickly provide two resources that really go into detail about this practice and having an understanding of how it impacts communities today. There's a book called Color of Law, or if you're more interested in a 15-minute video, Segregated by Design is a great option. Okay, one more resource that I wanted to point out is the Utah Health Improvement Index. And this is a composite measure that the Utah Department of Health created to look at social determinants of health. And they took 13 measures of social determinants of health like income, education level, single parent households, poverty rates, and then classified 99 small areas in Utah as different levels of health improvement. So the red are areas that are called very high HII, and these are the areas that have the most need. Again, this is not a measure of health outcome, but it's really highly correlated to health outcome. So you can see here that if we were to look at diabetes rates in Utah, diabetes rates are much higher in areas that have a very high HII, those red areas. Same with obesity rates, food insecurity. Physical activity is lower in areas where there's a high HII. So we can see through the data how these two areas are related, the social determinants of health as related to the health outcomes. So kind of a practical example of that. So when we first take the opportunity to find the health disparities, to identify them within our communities, to understand where they exist, then our next step is to look at the policy systems and environment changes to help improve those areas. So this is an example from active living. What are the kinds of changes we could make in our community that would improve rates of physical activity? And then being conscientious of where we're doing this. So we want to make sure these are benefits that are accessible to all members of our community. So we don't have the experience where we can live in a neighborhood right next to another neighborhood with a 10-year life expectancy difference. So those are active living examples. Here's a few healthy eating examples. So again, these are policy system and environment changes that lead to improved healthy eating, and again, making sure that those are available to all members of our communities. So I want to just provide a quick sneak peek of a program that's being announced tomorrow in the mid-afternoon general session. Get Healthy Utah and the Utah League of Cities and Towns is announcing a Healthy Utah Community Designation Program. So tune in tomorrow. I don't want to give any spoilers today, but tune in tomorrow to learn a little bit more about how your community might qualify for that if you're working on objectives to improve the health. And then there were 4 cities that will receive this inaugural award tomorrow as well. So tune back in tomorrow to learn a little bit more about that. And then I'm going to turn it over to Molly.
Thank you, Sarah. Let me just pull up my screen. Okay. Thanks, Sarah. Once again, I'm Molly Robinson. I'm one of the planning managers in the planning division for Salt Lake City, and I'm happy to be here today. I'm tasked with teaching everyone about urban form, which is a massive study of the urban form, massing, height, and articulation of the built environment that is proportional to humans and the speed at which they walk. That's kind of my working definition. But basically, it's the physical makeup of the city itself and the shape of the city. It entails everything from the arrangement of the street network to the height of the buildings and kind of the spaces in between. In Salt Lake City, kind of the basic building block of what is our downtown grid, which is a grid that is repeated throughout the state of Utah in many cities and towns, and even beyond, is based off of what we know as the Plat of Zion. It is the foundation for Salt Lake's urban form, and it has a very regular and large grid system. And this large grid also happens to be one of the region's most unique and identifiable characteristics in terms of city building. However, our block size is quite large. We have blocks that are approximately 660 feet by 660 feet square, with street rights-of-way of 132 feet. This is kind of the standard, particularly in our downtown and east downtown area. By comparison, when we look at other cities, Portland's small downtown blocks, we could fit 9 of them into one of our blocks. And that has a relationship to walkability. And I'm going to talk a lot today about walkability and that as kind of a determining factor in placemaking and health. So I will keep coming back to that as a theme today. In Salt Lake, as our example, the original kind of large plots of land within these large blocks were very quickly subdivided, and we started to see some more defined smaller pedestrian networks kind of cutting through these blocks. And you can see that in this grid comparison between Salt Lake City and Melbourne, Australia. Melbourne, Australia has the same block size, 660 feet on each side. Their downtown grid typically has a what's called a laneway, which is a 30-foot wide alley that bisects each of their blocks. And then they have a much more defined kind of mid-block walkway network throughout their downtown grid, which they call their laneway system. Our blocks are not regularly divided, but we have these similar sized blocks. The characteristics of our street network are that, and something that I hear very often from visitors, and certainly was my understanding of this place when I first moved here, was that this grid is very unwalkable. There's not very many choices in how you get from point A to point B. The blocks are very long and can be somewhat monotonous in your walk, and that doesn't do very much for our kind of natural tendency to walk from one point to the other. A monotonous walk is a boring walk, and it doesn't get us to walk more. And walking is kind of like, you know, the basic, most democratic form of transportation. And in the context of health, is one of the most basic exercises that you can do. When we look at Salt Lake City in comparison to some other cities in the US and around the world, we can very, very quickly see how rigid our grid is and how large. This is a study called Morphology, where we look at the scale of these blocks, the scale of the streets, the rights of way, and it's kind of this a comparison study between these different cities. Each of these diagrams on the screen are all showing 1 square mile, so these are all at the very same scale. Oops. Oh no. Okay. This is by comparison, looking at Ahmedabad versus Paris. And you can see the fine-grained nature of the street system in Ahmedabad versus Paris, with the very wide boulevards and the differences in kind of how people might get around in these places on foot. This brings up a point that I wanted to make about intersection density. Typically, the smaller the blocks, the more intersections you have, which is a measurable factor in supporting the walkability of a place. And this is a phenomenon that has occurred in cities with larger blocks, as the division of those blocks with streets, alleys, walkways creates more intersections and therefore more enhanced walkability. In terms of city making and planned cities like Salt Lake and like many communities throughout Utah, there has been a long-term relationship between public health and city making in the form of the city itself. And one example is the width of our streets, and the width of our downtown streets with 132-foot rights-of-way has many truths and myths around it. I'm not going to get into all of those. In Columbia, South Carolina, they also have some very wide streets by design, and were related to a public health concern in the 18th century when Columbia was selected to be their new capital city. The city commissioners were particularly concerned about the spread of both fire and disease in their community. And in particular, disease spread by mosquitoes, which at the time they were very concerned about malaria. And it was commonly understood at this time that mosquitoes could only fly 60 feet before they needed to land for some kind of sustenance, if you will. And so they made all of the boundary roads in the city, or they made 4 boundary roads in the city 150 feet wide and all the rest of their streets 100 feet wide, assuming that like the mosquito couldn't land on someone and then have that person carry them across the street. They figured if they had this vast open space in between the buildings and things like that, that the mosquito would not be able to travel across the street and thereby spread disease. Well, obviously that's not true, but here we are, more than 200 years later, and we have these very wide streets left over from this very real public health concern. And now we have a whole different kind of public health concern with these very wide streets where we have large vehicles, we have large crossings and people on foot trying to get from one place to the other. And as I said earlier, walking being kind of the most democratic form of transportation, it is the most equitable form of transportation. And yet we do so much in our work in cities and towns to promote moving vehicles as opposed to moving people. And moving those people safely. So one of the things that that I like to really think about is how we might begin to consider these wide streets as opportunities, not just to move vehicles and goods, but also are there opportunities to carve out more space for people, more space for ecosystem services, enhanced walkability, access to amenities.
Molly, you have about 2 minutes left.
Thank you. That said, in terms of walkability, amenity density, the proximity and density of what you can get to within a certain period of time. We often think about time and walkability as having that direct relationship. Proximity to neighborhoods, to neighbors, parks, schools, access to nature, access to services and things like that help create a more stable and interactive community in the long run, and that is an important outcome for health as well. Sorry, jumped a little fast there. Two other things I wanted to mention in terms of proximity and access. When we look at proximity to a park, for example, research has shown that up to 150 feet from that park, the neighborhood adjacent can be up to 2 to 9 degrees Fahrenheit cooler than other parts of the city further away from the park. And so that access to the park is not just important in terms of getting there and engaging with that park, but it can also have financial, energy use, and physical comfort and health outcomes and relationship as well. Finally, I wanted to mention some other research on walkability as it relates to urban form. There's a center at the University of British Columbia in Vancouver, and they have had many studies linking walkability as determined by urban form to lower rates of chronic illness such as diabetes, heart disease, and the argument is that a more walkable environment is a more healthy environment by nature. Thank you.
Thanks. So now we'll pass it over to Ashley.
Good morning, and thank you so much for your time. My name is Ashley Cleveland. I work for the city of Millcreek, and I manage the Promise program. The Promise program does its absolute best to look at zip code data around health, safety, economic well-being, and education. And then we try and use collaborative approaches to address any issues that we're seeing within our data. So I'm going to go ahead and share my screen. Okay, so this first slide is really to give you guys an understanding of equity in a city and what those branches look like. Sarah already had a really great in-depth discussion about the social determinants of health and that image about blocks that need to be added to certain things. And right now we're seeing a lot of gaps in these areas in regards to poverty, health, and the environment. Please take some time to look at these terms and Google them with city in the search bar, and you should be able to come up with a lot of articles and information that you can delve into on your own. There's some really great existing examples of what other cities have done. And so this is just going to be a little research landmine. Next, I really want to talk about what those barriers are and, really touch on the fact that these are avoidable. When we talk about disparities in health, they are avoidable, and everyone here attending this conference as a practitioner, you have the power, the wherewithal, and really good engagement structure to be able to avoid some of these pitfalls. So if you put the barriers to equity next to the branches for equity, you'll be able to see exactly why these two are next to each other. So in regards to poverty, when we look at employment, it's mostly a mix of industries. And if you have low diversity within those mix of industries within your city, you're kind of relying on one industry. And if that industry isn't necessarily accessible, meaning you don't have an institution that allows for a pipeline for your children and families and adults to reach into that employment arena, then that's going to create a bottleneck. And it's a social bottleneck that has an effect on your health because you won't be able to afford healthcare. There's also stigma attached to being impoverished and in poverty, which also keeps you there. There's investment into our areas that have impoverished people. There's also debt that's involved with getting to secondary education. That's a huge barrier to getting out of negative situations that impact your health. So these are some more blocks that need to be added to make sure that people can have equity. It's not necessarily about equality, it's about making sure that we fill those gaps. Right now, we have a healthcare system in our state and in our nation that is rather monolithic. It's on a large institutional framework, and our zoning doesn't necessarily support having a large institution everywhere in the state and every city. So there might be, some options at looking at fine-grained clinics or urgent care centers in areas instead of plopping an entire huge hospital in the area. Also, there's legitimacy in regards to health for communities of color or minoritized communities. We oftentimes, some of our health practices or things that we need aren't necessarily legitimized. We're still even working on our culture and making sure that nature is seen as an intervention for health. Other countries, they have doctors that even prescribe time outdoors as a way to address some of your health needs. And we're still trying to get over that hurdle. We have innocuous zoning that we could really be looking into and putting more effort into that. Innocuous meaning it wasn't necessarily something that we built, something that we administered, but we are now responsible for it as the keepers and the holding of those zoning practices. So we really need to look through what some of those existing infrastructures look like and address them. When it comes to our environment, we've given low investment into our parks and into some of our trail systems and into some of our water quality initiatives. We also have an issue on public transportation focus because we are rather car centric, as Molly brought up. We need to maybe look into some of our regional management a little bit further so we can have a higher impact on a county level. And then I'm going to move on to resolutions, right? So we can talk about barriers all day. We can talk about how we've had an impact in a negative sense. But once again, I would like everyone to feel empowered in knowing that these are avoidable things and there are resolutions that exist. We can invest in plants. We can look at our landscaping ordinances. We can incentivize biodiversity. We can incentivize solar. We can look at our stormwater management plans and maybe look at, creating new ones. We can look at our zoning near natural amenities. I know for personal experience, I live in Rose Park, that majority of the places that have the really nice trails that you want to go to that are within a 10-minute drive, the housing zoning around it is low density single family. So maybe if we look at some of the density, as Molly mentioned, the amenity density index that we have in our cities, that would be a great resolution for equity around the environment. I definitely think we could also make bus rapid transit family friendly. We don't necessarily have a lot of bus stops in between places of employment, grocery stores, and housing. And how do we make it more family friendly? And then, of course, looking at pedestrian transit oriented development and design as a standard practice. Molly talks a lot about creating more fine-grained connections within cities, and that's definitely something that we have the power to influence and change. In regards to health, we can look at our zoning for health facilities. What acreage is normally needed for things like that, and can we do it on a smaller scale? I definitely think we need to put more investment into parks that are generally used by Black, Indigenous, and people of color populations. We can have a bigger impact on food deserts by making sure we have more zoning or more relaxed zoning for community gardens. And of course, having those conversations with larger grocery store chains the same way that we do with the tech industry. That is the industry that we also need to be bringing into our state as our population grows rapidly. Food security is a huge, huge determinant of health, right next to being active and being healthy. And so if we can really focus on food security, I think that would be an amazing intervention and a resolution for equity. So really focusing on adding more building blocks in that area. And then one thing I've been thinking a lot about, because I do live in Rose Park, I do live next to areas that are really impacted by our poor air quality, and I am a mother. We have a higher rate of asthma and breast cancer in our zip codes. And one thing that I think is really interesting is, if we know that this exists, we have the data, we know the redlining and historical background, why is there no conversation about maybe providing free screening for people who live in those areas for asthma? Because it's a preventative measure. If you find out about it ahead of time, you have a better chance of being able to address it. Another thing in regards to poverty in cities and equity, once again, like I said, making sure you have a very diverse employment pool, making sure that you're having conversations with your developers around what they're going to house in some of their developments and what that zoning looks like for mixed use development. Looking at increasing home ownership by maybe increasing the density of single family home zoning, and not doing spot zoning, but in a comprehensive way. Maybe having a really deep discussion with your in-house legislative manager about the regulatory barriers to affordable housing. I mean, this is the Urban League of Cities and Towns. I know that you all do a lot of legislative work, and I think that's really amazing. We can really focus on putting more building blocks in that area. And then as a Promise program manager, you know, looking at the way place impacts all of these outcomes, become familiar with your intergenerational poverty neighborhoods. I know that, you know, we have our redlining data, we have our child disparity data, but we also need to be looking at the fact that poverty is intergenerational. It's as intergenerational as diabetes. And once you can, you know, slow the rate of which that is happening, the bigger impact you will have on all of these other things.
Actually, you have about 2 minutes left.
Okay, so next I'm going to talk about how Millcreek is addressing that. We have our Promise program where we're looking at health, safety, economic well-being, and education, looking at zip code data and working with existing partners like Get Healthy Utah, Millcreek Promise, things like that. There are ways to look at this in your city. And then secondly, we have been working a lot with a park in our city that generally houses our refugee community. So we've been talking directly with the kids and the families who live there and utilize this park on the changes that they would like to see. And that is what they came up with. They are their own holders of their experience, and they are their own professionals. We don't necessarily need to hold everyone's hand in design. So I think that's a huge thing. There's going to be a link provided if you would like to see a video of how that turned out. It's really great. And then one thing I would like to all leave you with is this restorative justice slide in city equity. Invest in assessments. Weigh your responses based on representation when it comes to your community engagement. Making sure that there's an equal voice to owners and renters in regards to how we notice. Fill gaps presented with culturally appropriate interventions by making sure that people who generally are not in the room are there and being compensated for their time, or at least supported in getting there. And be mindful of what safety means for others. So just as we think about how active transportation is a really great intervention, and it is, but that might not be the way that everyone experiences active transportation. So be mindful of what these definitions mean for others. Here are some links for knowledge of city equity. Robert D. Bullard and Mindy Thompson-Fullilove are great guides in that endeavor. You can also look at the future of equity in cities, and there will be links provided. And then for at least the urban leagues of cities and towns, we can evaluate and change things through partnership, compensation, looking at tech and IT support plus, making sure that we're having inclusive language to support our BIPAC communities, and looking at our land uses and doing an equity audit. Thank you for your time.
Thanks so much, Ashley. Great. So we'll pass it over to Sharon. Sharon, it looks like you're muted.
Thank you.
Yep.
I'm honored to be here at League of Cities. I really enjoy both the local and the National League of Cities Conference, so I'm very pleased that we have a chance to do this. Now I'm going, where is my share screen? I'm going to talk a little bit about, let's scroll down, sorry, about the city of South Salt Lake and also about transportation as a driver of inequality. Sorry, I got to go back a little further. And starting with just sharing stories that I've heard as a planner for this city, but also as a resident of Salt Lake City, and also just as a person who actually likes to be outdoors and utilize our streets for recreation and just for getting from place to place, and trying to just make some points about what we can do to equalize things. I'm sorry, I'm having a little bit of struggle on getting it full screen. Just a minute. I feel like I would
actually where if you hit exit full screen, so right click exit full screen, and then up at the top you should see a present. Yep, just go ahead and so up to the right. Yeah.
Okay. Perfect. Great. I just want to make sure I'm right. So
yep.
How impacts health equity? This is a view of our city on State Street. It's a very romanticized view in the evening at the new Ritz Classic apartment buildings built on State Street. But we know as South Salt Lake, as the city on the move, as that's our logo, that we have a lot of challenges when it comes to how transportation has affected us over the years. Just scroll down again. This is what the city looks like on the east side of South Salt Lake, where we have mostly residential. Our city is largely industrial and on the west side of the city, and largely residential on the east side of the city. It's kind of a tale of two cities. We're first tier suburb with classic housing stock, but we're also the city of industry, and we have a lot of facilities that do impact our health, including 2 interstates, 3 state highways, such as State Street, rail yard and rail line, sewer treatment plant, a couple of jails and detention centers, industry and brownfields, both current and old, and recently a homeless resource center. These don't just create some health issues themselves, but they create access and barriers to people wanting to be a part of the community, feeling like they belong, and feeling like they're safe where they are. So those are kind of the obvious challenges, the health and environmental equity challenges. But then if you take a little deeper dive, you can kind of look back at the history of South Salt Lake and some of the other things that changed, that transportation did, that have impacted our city's health and just success. First, construction of I-80. It's a great thing it got built, but this was the Forestdale Country Club neighborhood, both in Sugar House, and then as you went further west into South Salt Lake, it was a very stable, strong neighborhood that was higher income and popular, but having that neighborhood cut in half had its impacts. This is from during construction time. You can see you just took down the houses that were there. Also, I-15 cuts our city in half. This is a view around the same time, showing some of the things that were happening in and around I-15, which then ended up also creating the perfect conditions to focus on industry instead of on housing. So that, leading from that, you end up with some struggling retail. Whether it was a lack of rooftops or a perceived lack of income, we ended up with not the best retail, or with no retail at all, including a lack of grocery stores, which we'll come around to later. And then we had a lot of people just decide to move to the suburbs, which part was driven by, desire for bigger homes, but part was driven by the kind of declining of the neighborhood and feeling like it didn't have the resources that people wanted in a desirable neighborhood. Then a lot of infill with multifamily housing. This is a good chunk of our affordable housing today. There were good intentions with that, but many times we don't have good outcomes with some of those buildings because we don't have necessarily the best management of the buildings, or they weren't necessarily put in the best places. And then as over time, State Street 700 East and 3300 South have turned from smaller highways, smaller roads, into major highways, really. If you looked at Google Maps and said, oh, those roads look kind of in proportion to the other roads around them, well, it's because the other roads around them are already 66 feet wide, which is extremely wide. So when you put a 132-foot wide street in the grid, it doesn't really shock you anymore. And then finally, we have had at this city a lot of school closings. Was it due to academic scores, population drop, or a phrase, nice white parents, which if you have not listened to that podcast, it's pretty interesting, just the forces of who gets to shape the decisions made in our school districts and how certain schools are either remain open or closed. For those of you who know South Salt Lake at all, Granite High School was a really big deal for the city. It was one of the premier schools, not just in our city and state, but really around the country. And it ended up being closed after some declining populations and just decisions that this wasn't the place to invest in, which had a huge impact on our folks, because now we've not only lost our local school, which is a really great thing, but we have lost that community, the place where community gathers. We've lost the running track, we've lost the green space, we've lost the trees, we've lost everything that really kind of improved the community. So that's not exactly related to transportation, but again, a larger institutional choice to make a change or to build or unbuild something that affected the community. And then finally, the Jordan River. I say the good, the bad, and the ugly. People have lots of different impressions of the Jordan River, but we think it's beautiful. It just has a lot of work to be done, and it has been something that hasn't been invested in as fully as you would expect for something that's such a great recreation resource. So again, I'll ask, is this institutional or is this intentional? A lot of talk right now about institutionalized racism, institutionalized inequality. I just want to make the point that the larger organizations, including cities, including agencies, make these decisions every day that end up impacting our folks. You and I included, and most of the time people who have much less representation and power that we have. So I'm going to dig a little deeper into transportation in the City on the Move. We have really great transportation. That's why we said we're the City on the Move, but it comes at a price. So we have good highway access, great transit, pretty good sidewalks and walkability. We have a decent walk score. We have bike lanes and trails. We have lots of destinations, which are a part of walkability and walk score. There's 2 jobs for every person here. We have local cities dispersed around the city. We have good social services in every neighborhood. We have a business district. Sounds pretty good, but as I mentioned before, I-80 does divide our city. The streetcar is a great new addition, but most of our residents who are lower income will tell you they can't afford the transit, so they don't take it. We have some great places to walk. These are a couple of views from a new trail, Millcreek Trail in Fitz Park, and some walking paths, but they're destinations you go to walk. They're not a part of your everyday fabric of your streets oftentimes. Again, we have 3 great trails in the city: Jordan River Trail, Millcreek Trail. I'll point out Millcreek Trail has to go under a highway through a pretty sketchy pigeon-infested area just to get to the Jordan River. We have Parley's Trail. This is Parley's Trails in Salt Lake City, where they had invested millions of dollars in the Greenway and along the S line there, which is fantastic. They had the money to do it, but being a smaller, lower income community, we have not made it to that point yet of having the landscaping. We've got some landscaping, we've got the trail, but you can tell the lack of investment does show. And we've tried our best, but this is just not an institutional priority to pay for spaces like this for people. This is actually on part of this trail. It's a great trail crossing. It was done right. It feels safe. You've got a button to push. You know exactly, you can get it across in that amount of time. This is a different example of crossing at a transit station. This is the 39th South Tracks station, which doesn't actually have a crosswalk for people across the road. And if you are even just crossing the tracks, it's a little bit, it does not look as easy and comfortable as the last one did. Here's an example of a couple of our bike lanes. Most of the people in all the pictures I take of bike lanes have guys of adult age riding in. They don't have women, children, families riding in nearly as much. But sadly and oddly, there's also a lot of motorized wheelchairs in these lanes, because this is the best choice, because our sidewalks aren't up to snuff either. So I take a lot of photos of that too. And who would really want to be just in a seated position on a chair, either on a bike or in a wheelchair, that close to people traveling 30 to 45 miles per hour. As a city, we've done a lot to work on biking. We realized, we also have a Promise program, Promise South Salt Lake. We realized in working with our kids that while we've been building great infrastructure, many of the kids don't have bikes. They can't afford it, they get stolen, goat heads, they have flat tires all the time. So we have worked with a partner called Free Bikes for Kids, and we just give away bikes. It's become a really great thing. But still, many parents won't let their kids ride those bikes on the street. We also have Green Bike in our city, our first Green Bike station. Green Bike has been trying hard to get people to even take rides for free. But again, it's a bit of an obstacle for some people to put that into their head that they can ride on our city streets. I'll just point out a great example of where I'd like to ride in Park City on one of their trails. This is the level of investment it takes to make people feel really good about riding the bikes. That region has the money and has put the money into it. If we had these all around our city, we would have people riding bikes everywhere, I guarantee it. So instead, people take to the streets for recreation. I love this. Everyone's on these rollerblade cross-country skis in this picture. So this is all our alternate. We have a lot of public space dedicated to roads in our community. In fact, it is the #1 source of open space in our community. It's not parks, it's not our creeks and so on, it is our streets. So can we actually take the opportunity we have here, an investment we have here, and make it work for people for more uses? This is the cheap option for recreation. It was a very big investment of money. We've put all this money into it. Let's open it up to other uses and create that sense that everyone has some ownership over this. I point this out. Okay, great. Point this out as another example of what we call a sidewalk. We have pretty decent sidewalks here, but this doesn't count as a sidewalk. You know, when you have spots like this, it just kind of throws a bomb into the whole system. The ability to get down a sidewalk or go someplace in a wheelchair. These are a couple examples of 4-foot sidewalks can sound great until people don't clear their weeds. And sidewalks are great until they dead end and end up in parking lots where you're basically competing with cars for your safety. So I'm gonna jump into just generally, sorry, I've got my notes, generally a discussion about health and equity. So we've got great parks in the community, we've got water, we've got trees, but we also have places like this, and you can see the pedestrian in the middle of the street where people are literally putting their lives at risk to be, go about their daily lives. This is a crossing on State Street. We worked really hard. This is really good crossing on State Street, but absolutely nowhere near what people feel like is a good place to live. And there's no surprise that we have so many pedestrian deaths, et cetera, on State Street and on other places. This is State Street, I'm gonna guess 80 years ago or so. It's actually what it looked like then. We actually had horses and carriages on there. That's the Granite School District headquarters at that time. Today, you can kind of see our water tower in the backdrop. Today, our Granite School headquarters is on the far left. It's the old hospital building. It's the multi-story tan building. You can see that it's surrounded by I-15, I-80, and State Street. You have to cross State Street to get there, which is a problem because we have an elementary school that moved there. This is where one of our elementary schools was, but then it was moved to the other side of State Street, where it's almost impossible to get to. So we turned it into community center. We're super proud of this. This is kind of a mid-construction photo when we were building the playground and the community gardens. Had a great ribbon cutting. This is Mayor Wood with our Promise Program kids participating in the boxing program with Police Athletic League there. It's a great, amazing space. We just had to recycle what we had and make it better. So for the last couple of steps, I'm going to talk about a project we did recently jointly with Salt Lake City, which is Life on State, showing kind of the current condition on State Street of mix of businesses, 3 lanes of travel in each direction, a turn lane, a parking lane, how it is today, and how it could be in the future. We've been trying to visualize how we can actually make State Street a place for people. Well, you've got obviously investment in buildings, you've got better crosswalks, you've got landscaping, the transit is still there, both the S line that is there and the bus that's there. This takes money, this takes a lot of money. This is not the kind of investment that happens in low-income neighborhoods. This is the kind of investment that happens in gentrifying neighborhoods. So what can we do to change that? And to make every street feel like this kind of street, and every neighborhood to feel like you can walk where you want to go, actually see neighbors on the street and enjoy it. I'm going to cut my, I'm going to give one quick thing about direct impacts from transportation. You guys probably know this: pedestrian and bike accidents, car accidents, asthma and respiratory diseases. We've got the cumulative health impacts, mental health, there's chronic stress. It is a disease if you have these type of stress factors of, can my kid get to school? Can they cross the street, etc. Risky behaviors, a low sense of belonging, high suicide and accidental death rate, sorry. Those are some of the statistics that go into the early slides that Sarah showed about our city's health. And then there's our physical health with asthma, obesity, chronic diseases, a few places to grocery shop, although we did change that, low rates of physical activity, physical and mental abuse, etc. So I have a few more slides in here that I won't get to, you can review later when you see the presentation, but I just want you to ask yourself, when did our last multi-million-dollar project, what did our last multi-million-dollar project fund? Many of these transportation projects are in the tens of millions of dollars. Many of the projects I showed you scraped along for bike lanes or parks or trails in the tens to hundreds of $1,000s range. We could do so much if as institutions we decided to reprioritize what we were putting into. And I have some optimism. There are lots of cities hiring transportation planners from different backgrounds. There are lots of new funding sources for these changes, but we've got to speed up and get to it. So, you know, when you look at how it was spent, who benefited and who was harmed, people in the car, I'll tell you right now, are the people benefiting 99% of the time. And the people that are designing these things are driving in cars every day. So who decided to fund this project and why? So I want to leave those questions with you in the context of health and equity, because you guys have the ability to make the decisions differently. And the resource I'll suggest, I won't get to my last slide, is Margaret Wheatley, who's an author who's put together some really great books about leadership and about change based on listening to your community. And her phrase she uses often is, no one's coming to save us. We have to do it ourselves. It is entirely possible to do this ourselves. You just have to be listening and make the choices. And that's my message to you today.
Great, thanks so much, Sharon. Well, I want to jump in. We have about 3 minutes left. Wish we had more time, but we would love to take some questions at this point. I really hope that we can. I think it's opened up now, or maybe someone from the IT group can help me understand how we can take questions from the audience.
So the attendees can raise their hand, and
Perfect.
on the queue under the, I believe it's participant section.
Okay.
You will see 2 sections.
Great.
One of them says panelists, one of them says attendees, and then the ones that would like to talk, you can press allow to talk.
That's it. Yeah, there's really no one else.
Great. And I'm sorry, I misspoke. We do have until 11:30, so we have a little bit more time. So if people want to ask specific questions, raise their hand to do so.
Attendees are also more than welcome to ask questions in the Q&A section or in the chat if they don't have access to a computer.
Oh, perfect. So you can chat your question as well. While people, I'm not seeing anything pop up yet, but that's okay. While people are maybe getting acquainted with how to ask the questions, we do have a couple of questions that we can jump into that we've prepared in advance. And then like I said, we'll entertain questions as they come up. So one question, I'll start with a question that I've been thinking about when I reviewed everyone's slides in this panel discussion is I'm curious how all of you are making sure, or in the organizations that you work with and for, how are we making sure that we are, and I have actually written in this question in all caps, how are we making sure we are actually listening to those who are underserved and underrepresented in either the cities or the organizations that you work with? So maybe I'd love to start with maybe Ashley on this question, and then we'll bounce over to everyone.
One thing I've been doing, so the Promise program at Millcreek is new. We're only 2 years in, and I just switched over from being a city planner. So I'm learning while I'm going. But being someone who is from a minoritized community and has had many hurdles in my own personal life, that has really helped me with my lens in approaching engagement. So I definitely think about, one, where is City Hall? Is it accessible for people to get to? And then when we have city meetings, is it really accessible for people with families and who work different hours and who speak different languages? And is it even a comfortable space for people to be in, considering that it is predominantly very professional and predominantly very white? So, recognizing what safety means for other people. So that is what allowed me to do all of our design practices for our park at the park with the children, and taking a stab at, you don't have to be perfect at it, but you have to at least try, taking a stab at translating your survey materials, right? Google Translator exists. There are parents that speak different languages that wouldn't mind giving your survey question a once over and saying, oh yeah, like that's translated right. You wrote it in the right cadence or whatever. Another thing I've been doing is, anytime we're having any intervention discussions, before we make a decision on moving forward, I at least try and get some parents who aren't in the room from schools at the after school program, or working with the principal and making sure that it's a safe arena for me to converse with them in to make sure that we're heading down the right path. And I'll do that before we make a decision and move forward.
Great, those are great examples. Maybe we'll jump over to Sarah.
Yeah, so we're not a city level or community level organization. We're a statewide, collaborative organization. So for us, it's really important to be thinking about when we have a partnership or committee or coalition or even our board of directors is to be looking at who's involved there. And I would say, we have in the past year written as part of our mission a statement on health equity and trying to do better at in whatever project or coalition that we're working on, making sure the right groups of people are represented and that we are not trying to speak for another group of people or another community. Sometimes it feels a little bit more difficult because we're not on the ground in a community, but it's still really important. And I think it's something we kind of try to keep pushing ourselves towards to make sure we're doing better.
Awesome, perfect. Maybe let's do Sharon and then Molly.
So I like what you said about not speaking for other people, but a lot of times we have to speak for other people because they don't come to our meetings, so they don't participate in like the formal process. So I find one of the best resources for us to learn more about residents want is our employees. Like Millcreek, we have a Promise South Salt Lake program that has amazing employees that are very in touch with the kids. And they're also like 20 to 30 years younger than me. So they actually have a totally different perspective on what's important in the city. So even just asking employees, what are people doing? What are people concerned about? What's the problem at your center or at your street or on your block is really helpful. And that doesn't just include our Promise employees. Our public works people are pretty aware of where there's problem points with crossings and things like that. It's just good to start there because you'd be surprised how much the people who are closest to you, you can actually ask that question to, really do know. So that's a quick suggestion.
That's a great point. Molly.
We've used a number of different outreach methods. Of course, I'm going to offer a few suggestions that are not really COVID friendly. But in the past, we've done outreach like directly in the schools. Sharon mentioned the Life on State project where we went into a 6th grade classroom and talked to the students about, how do they get to school? Their school is near State Street. How do we, what kind of environments and activities and things are they interested in doing, and did they want to be able to walk to, from their home or from their school? And kids usually they're so uninhibited. They'll tell you exactly what they think. And their insights really do stand the test of time. They're not generally as trendy as you might think they would be. So that's definitely a great opportunity. Plus you can also kind of get, if there are language barriers, you may be able to get to the student who is in a household where English is not their native language, and you may be able to bridge some gaps there. We've also done outreach where we've kind of packaged a small workshop together, like a workshop in a box type of thing, and brought the workshop, brought the questions, brought the conversation to the community. And that's both for kind of the business community, but it's also for residents as well, and not always expecting them to come to us. More recently, literally like just in the last couple of days, we're finally getting some good analytics from our website in terms of just basic outreach on current projects the city's working on in the planning division in particular. And even though we are not doing like in-person, like open house types of events, we're getting, in the hundreds and even thousands of hits on our website for projects. And maybe it's because we didn't know what kind of hits we were getting before, but now we recognize that this is a much more valuable tool, and we're going to try to expand kind of the interaction and how people not just coming to get more information, but being able to ask questions and kind of poll people about their thoughts on projects like our affordable housing overlay proposal that we're working on now.
Great. Great, those are all really great responses. Thank you, everyone. Just want to remind attendees that you can use the chat feature to chat a question. I'm monitoring that, and so would be happy to relay, those chat questions, or I believe you can raise your hand to then, again, and to ask questions. So I'll jump into another question, and just as so we all know, I'll post the links into the chat here in a moment. So that's from our resource page. So it includes all the links that all our panelists discussed within their presentation. So you have that for after. But so another question I want to jump into is, it was originally, I wrote it for Sharon, but I think it's really applicable to everyone. So I'd love everyone's thoughts on this. It's, a lot of the projects or points that you've all mentioned within your presentation involve other organizations or stakeholders. And I'm really curious what your experience is, collaborating is, what your collaboration experience is working on these, projects with different stakeholders, whether it be, I work for UDOT, so obviously, like if it's working with the DOT or other groups, but I mean, honestly, any example of working with other organizations. And I'm curious kind of the successes and failures. And one other point on this is we can think about this question as it relates to equity. So, what's an example of a project you worked on with equity with other stakeholders, and how did that go? So maybe let's switch it up. Let's start over. Let's start with Sharon.
And I'll say Molly can also talk about this because we both worked hard on both the S-Line and State Street. And obviously UTA was a big part of this, as well as UDOT. It's always a little bit of challenge because different entities have different goals in mind, and I really wish our goals were more closely aligned. But again, I said I'm optimistic that we're hiring different people into transportation who can help kind of rebalance rebalance transportation. I'll just say it that way, and I'll let Molly answer.
Yeah, I was going to say that when we're looking at these kinds of outcomes, one, getting people involved in the conversation earlier is certainly important, but when we're looking at multi-stakeholder processes, it's often challenging to bring in stakeholders at certain phases of the project, particularly when we're getting much more technical. For example, I'm working on a project right now on 3rd North and building a pedestrian bridge over the railroad tracks, basically on the west side of West High, connecting the Guadalupe neighborhood to where West High is. And historically, we know that students have just, when the train is blocking the road, you just jump over the coupling between the cars to get to or from school. Highly, highly unsafe, and the community has, expressed a desire for a better solution for this. There was a lot of early engagement in terms of getting this pedestrian bridge. We finally have funding for it, and right now we're in that kind of like technical phase of the engineering of the pedestrian bridge, which is really hard to kind of bring stakeholders outside, from the community into that kind of conversation. We will bring the community kind of back into that conversation when we start getting into some of the details of how we're going to light this thing. Is there, how are we going to celebrate the community through this bridge in a public art kind of concept? But the actual structure of the bridge itself, we're fairly tied in terms of funding and what we can do there. but it is a multi-stakeholder process. We've worked with a developer of the adjacent parcel to make sure that the design that we're working with is going to work with their future development. We've got to work with Union Pacific Railroad, which is not an easy group to work with because they have very, very specific technical requirements. And then it's a collaboration between UTA and Salt Lake City. So there's a lot of kind of like moving parts on this, and you kind of have to figure out when to bring in the different groups at different times. Even myself, like, because I'm interested in like, how does this bridge touch down, and like, is there a gathering place at the ground level, and what is how does that work with, you know, the new development, and you know, what's the natural path of the pedestrian or the cyclist, and how they're going to, you know, cross over these railroad tracks. But I'm not always like the best person to have in the conversation when we're talking about like, you know, the civil engineering of the structure itself and that sort of thing. So
that's great. Sarah, do you want to jump in on that collaboration? I mean, that especially with your organization, do a lot of collaboration. So we're interested in your thoughts here.
Yeah, and I think that I think the important thing to try to remember is that for any of these kind of complex problems, whether it's complex behavior change issues like we try to address, but specifically anything around equity, there's just no one organization can do that alone. The city government can't do that. The health system can't do it. The health departments can't do it. I mean, none of us can do it alone. So the key is really finding the groups and coming together and trying to find those shared values, those shared outcomes in order to improve outcomes for your residents. So yeah, I mean, I think we're nearly out of time, so I don't want to tell any specific examples, but I just really think it's recognizing we can't do it alone. We need to bring the groups together and take shared responsibility for those outcomes and really be we're doing our best to work together.
Perfect. Yeah, and Ashley, I want in the last, you know, we have 1 minute left. If you want to respond to that, I want to make sure everyone is aware. I posted the links from our presentation into the chat. Feel free and grab those because there were some great resources in there. So yeah, Ashley, I'll kick it over to you for the last minute to respond to that question about collaboration, and then I think we'll be wrapped up.
I think what everyone has said is great here. It's very true. You can't do it all on your own. I think we're at a point in time with cities where we really need to be thinking about the box about what we're traditionally supposed to provide. And, you know, we're not just an engine for development. I think when a lot of us became city planners or urban designers or landscape architects, we had very romantic notions about the impact we would be having in people's lives. And I want everyone to know that we can have that impact.
It's great. It's a great point. That's a great point to end on too, kind of a motivation. So thank you, everyone. We're at 11:30 on the dot. So out of respect for everyone's time, we'll go ahead and wrap up there. But thank you so much to all of our panelists today for such a great presentation. Really appreciate everyone's time.